All right, let's take you to the northwest now, where planned refurbishments of the Gelukspan Hospital have ground to a halt. The kitchen, mortuary and operating theatre were due for an upgrade. The contractors now claim that they haven't been paid for services rendered. Newzroom Afrika's Refiloe Seboko is tracking that story. She joins us live this afternoon. And what is the response, Refiloe, good afternoon, from hospital authorities to these accusations from people who have already, they say, provided services?
We're just about to find out. In fact, my guest this afternoon is a spokesperson of the Department of Health in the Northwest Province, Seboko, to respond to those, the company that was appointed, the contract that was awarded to the contract to do the upgrade and refurbishment of the Gelukspan District Hospital, that is. But let's speak to Seboko. Thank you so much and welcome to Newzroom Afrika. The state of dilapidation of the laundry service. This is the building. Talk to us about this building and what really is happening here.
Well, of course, this is an old structure. We just learned now from the CEO that this structure was constructed around the early 1960s. So you can see that the structure is old and dilapidated, as you say. So it means it's not a structure that is conducive to providing services. We sustained for so long with it, but it now came to a point where we needed to bring the structure down. And there are a number of units that we had to bring down to allow for construction of new units. And they include theatre, the laundry as well, as we have said. And we think that we should be far already in terms of the construction. Had it not been because of the challenges that relate to the contractor that were appointed, and the department is dealing with those.
And some of those challenges, the contractor says that they had to terminate the contract with the Department of Health because of the consistent late payments that they had to deal with in the 5 months that they had been working on this project.
Yeah, actually, that would be the side of the contractor, what they had to say. And they need to come forward and test those allegations, because from the side of the department, we have something else that comes from our infrastructure team that points to poor performance of the contractor. And in fact, the department was on the process of terminating the contractor, but the contractor was quick to then proceed to terminate himself. And we need to stress that the department, from the records we have, there was never a point where we are not paying the contractor. There were instances, of course, of delay payments. But when you delay, but you eventually pay a sizable amount, you think that any contractor who has been in the business for some time, who knows how to do projections, would be able to sustain themselves. We have these challenges all the time, where the contractors, for some reasons, they are paid and they quickly finish the money, and it becomes a challenge to sustain the project. We have cases where others decided to put up a cessation because they could not continue. And it's the case here, and we are always ready to come up with an intervention plan to speedily appoint another service provider. When we can confirm that another service provider has been appointed already, they will start with the project. What we can say to the other who has been terminated, if they feel that they have been hard done, it is within the law to come forward and lodge a complaint, a dispute, to challenge the termination, but I don't know how that will be done because they terminated themselves. Then we will take that matter up.
Just in short, just before I hand over, the contractor has been appointed. How long is it going to take for them to complete the project? Because affected kitchen, laundry, theatre, I can imagine that is also affecting the services here in Gelukspan Hospital, mainly affecting patients.
Well, if you can go into the hospital, you will see that the patients are happy with the services they are getting from the hospital. The condition is very conducive to this kind of service that we are providing. There's no crisis. 20 kilometers from here is Mafikeng Provincial Hospital, where we are sending patients if we maybe some of the services, like we are saying, they are still being under construction. 40 kilometers towards the east is General De La Rey. It's another referral. So there is no crisis. These are manageable distances. There are other facilities elsewhere in the country where there are longer distances for referral. So we are not struggling with referral here.
Thank you so much for your time. Spokesperson of the Department of Health in the Northwest Province, Seboko Michelle, he says that there is no crisis with relation to the contractor. They, through the email that they sent, indicating that for the 5 months that they were busy with the work here of demolishing the buildings, or rather trying to come up with a different structure, they did indeed get payment for that 5 months. It's just that the contract was for 18 months, but because they had to terminate their contract, that's why they could not continue with some of the work that still needs to be done.
Refiloe, Seboko, a case of he said, or they said. Thanks very much indeed for that update. Live to us there from the Northwest Province.